Hey there, welcome back. It's Shay and this is my 30-week pregnancy update. So we have a lot to talk about today, so I'm going to try to get right into it. As you can tell, we have changed locations. I've said in previous videos before that there's really only one room that we have that really works for filming, but today we're making it work in here. And Miss Prim is off camera, but she's in the room as well. She is on her bed, so I decided not to invite her up here for the video, but you will probably see her next time. Our blind parenting tip for the week is really just about adaptive tools and figuring out what you already have in your sort of tool bag or arsenal, and what things you might need when you have a child. So thinking about things like a talking thermometer. Do you have one of those? Do you feel like that's really important for you to have when you have a child? For me, it would make a lot of sense to have one, even though of course if you have a sighted partner you can always ask them to look at a thermometer screen, or you could use your phone to try to read one. But I would prefer to have a thermometer that is specifically workable for me, so that I always have access and I don't have to ask somebody else for help. So that's something I'm trying to get my hands on. I have heard that smart thermometers that connect with your phone can be a good option, and that way it doesn't actually have to be a specialized tool. It's just designed to pair up with your phone, and you can use your phone screen reader to read the results. And then other things as well. So once you have a child that's growing up and getting a bit more mobile, how can you keep track of your child? What are some adaptive tools you might need for that? So two things in that category that I thought about were jingle bells. This is pretty common among blind parents. So you can attach little jingle bells to their shoes or to their clothing, so that wherever your child goes, they jingle and you know exactly where they are. My mom actually said she used this technique as well, even as a sighted parent. So it is pretty common, I think, just generally among parents, and it's definitely a good technique to use if you're worried about your child getting into things without you being aware or maybe running off. The other thing you can use are shoes that are specifically designed to make noise. So I've heard of Squeaky shoes. I don't know where you get them. I will look them up and link them down below if I can find them. I'm not sure I want to go down that route. It sounds a bit overwhelming to just have constant squeaking. Like jingling is a little bit more discreet, but I think it's definitely another option if you feel like you want to have something that's maybe more reliable in the sense that it will never fall off. Like you're never in danger of the threads coming loose and then the bells falling off and going away. So it's definitely an option to consider. And the second thing in that category of just sort of keeping track of your child when they're getting a bit more mobile is to have a wrist strap or a toddler rein, I think is what they call it. You can call them reins, or a backpack leash. So these are kind of controversial, but in my mind, you do the thing that keeps your child safest when you are out and about. And if you feel personally that keeping your 14-month-old with a little wrist strap on or with a backpack lead that you can just hold on to make sure that they are staying with you when you're around traffic and you're around people, I think that's okay. If you feel like you need to do that, you should. Those are my thoughts for the parenting tip of the week. Moving on to baby and me and how we're doing. Baby is 3 whole pounds. She actually is probably slightly more than 3 pounds, 3¼ pounds now, which is crazy to think about, just how big she is. She was the size of a cherry just a few months ago, and now she's so big. She's so active, which is really, really good, particularly at night and in the morning still, but I do notice that she will kick around during the day as well. She does seem to have a pretty structured routine, so She seems to kind of sleep for like 2 or 3 hours at a time, and then she'll wake up and be really active, and then she'll go back to sleep and she'll be kind of dormant in there, and then she'll wake up again and she'll be kicking around. So I'm kind of curious to see if that continues when she's a newborn, like if she has the same kind of pattern of wakefulness and sleep, or whether birth kind of interrupts all of that and changes all of her rhythms. In terms of symptoms, I've been tired throughout the day, but mostly in the evenings, kind of similar to, I guess, like the early second trimester, maybe end of the first trimester. I was very, very sleepy in the evenings and like couldn't stay up at all. I'd get to like 8 o'clock and just be done. So I'm very much like that now, but also kind of sleepy throughout the day. Soreness in hips and back and kind of pelvic area, and then the sides of the belly have continued as well. Mostly when walking or sleeping is when I notice it. Sleeping has mostly been good. Like I do wake up and have to turn over all the time, but like it hasn't been too uncomfortable. Like I just turn over, I go back to sleep, it's fine. But turning over has definitely become more laborious. I feel like I wake up and I'm like, oh, I have to heave myself over. And that's kind of funny. It's just like a weird feeling. I've definitely had bleeding gums. That's been going on for several weeks. I don't think I've mentioned it in previous videos, but it's been there for sure. I actually ended up using a medicated mouthwash that my dentist gave me. I think it was like around 27 weeks or something, and he was like, just use this for a week or two, try to get ahead of the game when it comes to your gums being inflamed, and just brush really well and everything. Congestion has been an issue. I don't know if you can hear it in my voice. I feel so congested, but it might be allergies, so I'm not sure if that's pregnancy related. Occasional headaches, occasional foot cramps. That's kind of been a new thing. It's not happening all the time or anything. I just notice it from time to time. They're very painful. I don't enjoy them. Putting my shoes on is such a challenge these days, because I usually just sit on the floor to put my shoes on, but like it's so hard to get up from the floor now, and like I can't really get my knee like properly in front of my belly anymore to tie my shoes, so I'm like tying them at this really awkward angle. And it's just really funny. So I've started having to like sit on my bed to put my shoes on, and yeah, and I'm sure in the future I'm just going to be asking my husband to get my shoes for me, because I'm going to be like, I can't get down there. I had a weird moment at 28 weeks when I felt really lightheaded, my heart was racing, and I was just really faint, and I didn't really know what was going on, but my husband really encouraged me to get changed into pajamas because it was the evening. I did that. Come to find out what was going on, I think, is that my clothes were just way too tight. So I was wearing clothes that weren't maternity clothes specifically. I had noticed they were a bit tight when I put them on in the morning, but I was like, it's comfortable enough. But then by the end of the day, like I was so uncomfortable, and I did not realize that's what was happening until my husband was like, put your pajamas on, get in something comfortable. And then like it just relieved all of the tension. Like the faintness went away, the racing heart went away, the breathlessness went away, and I was like, oh wow, like I just need to be wearing looser clothing. Like this was such a simple solution. So praise God it hasn't happened since, and I've been way more careful about like just wearing what's comfortable, which is sad because I miss a lot of my dresses. I used to wear dresses all the time, and now it's just none of them really fit properly. So unfortunately it's pretty much jeans and, you know, maternity jeans and sweatshirts all the time. I think that's what I wear pretty much in every single video, so you probably aren't surprised by that, but yeah, I used to be a huge dress fan, but hopefully one day I'll be able to get back into it. I had an appointment at 28 weeks as well, which I was going to share about. If you've seen my video about my first appointment, you might remember that the blood draw at that appointment was quite difficult. I ended up getting stuck like 5 times, and it was just not the best experience. So this appointment was great because they did have to do a blood draw, but it only took 2 times. We were telling the midwife, and she was so sweet, and she was like, okay, we're going to try to make sure that doesn't happen this time. So she was like, let's try this part of your arm. And that didn't work. So she was like, you know what? We're just going to try where it worked before. And she used a warm cloth on my hand as well to try to just get the blood flowing and kind of get the veins to puff up a bit. And so, yeah, it was great. It only took 2 tries. I was like, thank you, Lord. And she told me to wear gloves and like really warm things next time so that my body is like flushed and ready to go. My hands are always cold, so I probably I think the midwife actually told me to do that last time and I just totally forgot about it. So yeah, I will try to remember to wear gloves next time. There's a little tip if you have issues with that sort of thing. The doctor had a little look at baby and she said she looks really good. We got to hear her heartbeat again, which I just love. It's so amazing and it was so strong. It was just really different from the first time I heard her heartbeat because it was very there's a lot of interference in the first one. And also she was so small and she was moving around the whole time, so they couldn't really catch her. She was flitting out of the kind of range of the little device, so the probe, I don't know what we call that thing. Anyway, the doctor did observe that she was in breech position, which she immediately said, don't worry, most babies flip. She said only 3 to 5% of babies will stay in breech position by delivery. But of course, what did I do? I immediately just started worrying so much. It's been definitely a struggle just trying to trust that to the Lord and give it to Him and just be like, okay, I have zero control over this. There's no point in me being anxious about potentialities when I really can't do that much about it. If we come to a point where we're later on in the pregnancy and we want to try to turn her, then yeah, we might be able to give that a go and there's something that we can do. But at this stage, it's just kind of in God's hands. And at the end of the day, even if we flipped her right before delivery, she could flip again. And, they could say, okay, we have to do C-section. My hospital says that pretty much if they're breech, they don't even attempt vaginal delivery, so they just immediately say, okay, you're a cesarean candidate and we're going to get you scheduled, basically. So they don't really even make the attempt, which is sad to me because I think it can be safely done, but then at the same time, the goal is having a healthy baby and a healthy mama, and if that's God's plan, then I need to be willing to accept that. Things I have been considering. So definitely the cesarean thing has been something that I have thought a lot about. It's not something that really, of course you always know it's a possibility when you go into pregnancy, but I just hadn't given it any serious consideration, and it really scares me because I'm not a fan of hospitals. I'm not a fan of surgery, who is, but my body has some specific issues with drugs and things that make surgeries a little bit more scary. So yeah, I find that alarming, but again, it's the Lord's will that will stand, and ultimately I know I can trust myself and my future and my baby's future to Him. So yeah, again, it's just been an exercise in trusting God, really. So just an update on Prim. We've been working on her jumping on furniture. She is a big dog, at least compared to an infant. She's a very small lab, actually, but when you think about a 50-pound animal potentially jumping on or trampling a teeny tiny infant, that's just really scary. I do trust her in the sense that I trust her around the baby. I think she will be very gentle with the baby, but she is a more energetic dog and sometimes she forgets herself. I really don't want to have the risk of potentially having the baby on the bed or on the couch or something and having Prim jump up there and accidentally pounce on the baby. So just working on only allowing her up with permission and making it clear to her that she has to get that permission first. She can't just jump because that's been a little fuzzy in the past. Lots of people ask me if Prim knows that I'm pregnant. I don't remember if I've talked about this before. I don't really know, like it's so hard to say, but I think she probably does. My friend pointed out the other day that she could probably hear baby's heartbeat, which I didn't think about. I was thinking more smell, like that she definitely could smell the hormonal changes and probably could smell that there's another little person in there. So I don't really know, but she does do this really cute thing where I'll show her my bump and then she'll just like put her nose in the bump and just like kind of leave it there, and she'll give it a little sniff or a little lick and then just like back up and look at me. And I don't know if she's just sort of humoring me and she's just like, okay, you want me to look at this? I don't really know what you're doing, or whether she actually has a real inkling of like, oh yeah, there's a little baby in there. Don't know. I would love to have a little window into her thoughts on the matter. Exercise is another thing we've been thinking about. So we're just trying to stay active, walking a lot, which has been great. And as the weather gets better, I think we're probably going to walk longer and longer stretches and more frequently. And yeah, we're really enjoying it. I have also been writing my birth plan, which my doctor told me to do for my next appointment. So not for my next ultrasound, but my next like proper appointment, which will be at 34 weeks. So I've mostly done that. I still have a bit of work to do and I need to print it out and things. But yeah, I could talk about that more in detail in another video. And I've been packing my hospital bag. Hopefully before the end of this pregnancy I will do a hospital bag video and just share all of the specifics of that. But for the moment I was going to show you baby's bag. So this is my nappy bag for diaper bag. I got it on Amazon. It's pretty cheap. So it's nothing fancy, but it's by a brand called Precious Snuggle, which I think is adorable and really funny. But it has lots and lots of pockets, which is great. It has sort of this front pocket with 2 places for bottles, which I don't know if we'll use because depending on breastfeeding, but if we ever need it, it will be great. And it has this little Velcro pouch where you can put things just really quickly without having to get into a zip. Then it has 2 kind of main zip compartments. There's a netted zippered pouch inside this one. I don't really know how I would show that to you. And then the main pouch has sort of a laptop sleeve. It came with this changing pad, portable foldable changing pad, which I think is really nice. You can just wipe it down when it gets dirty. And it also has a few other compartments in here, like a zippered compartment, 2 kind of just pouches for like wipes or things that you can put in there. So this is currently full of baby stuff for the hospital, and again, like I said, I will share that more in a specific hospital bag video, so be looking for that. Then just at the back of this bag, so there are 2 handles on the top, which is nice, so you can carry it by hand if you want to. And then it is a backpack style, and there are these 2 straps for putting onto your stroller, which is really nice. And then there's also this strap in the back, which you can use to push onto the handle of a suitcase. And because my husband and I plan to do some travel with our baby, I just thought this was a really great addition. And there's also a pouch in the back here where you can put like phone, keys, just like small little things. And then just like most backpacks, it has these kind of side pockets. This one is elasticized. It has a slit for wipes, but I don't really know why you would use that because it looks like they were just dry out. This one is just like a normal elasticized side pocket. Maybe you could put a water bottle in there or something. So that's her hospital bag and my nappy bag, which I just thought I would share today because I hadn't shown it to you yet. The other couple of things that we acquired too, our friend gave us a little bottle which, like I said, we're pregnant breastfeeding. I don't know how much I would even pump, but it's just such a cute baby thing. It just makes me really excited. So we have a couple of those, and then also some little cups that you can use for baby food when you're weaning. Weaning is something that kind of scares me, so maybe I'll talk about that in another video as well. But yeah, so we're slowly collecting baby's items, and it's just really exciting to get everything organized. So prayers and praise, just praising God for provision again. Like I said, just having the things that we need for baby organized and ready to go is just really encouraging. And we are getting gifts from people, and it's just such a blessing. I got kind of very stressed at like 28 weeks thinking about all of the things that we still needed to get for baby and just all of the money that we have to spend. So we've just had a lot of people coming out of the woodwork to help, and we are so thankful for that. One prayer is for baby to move into head down position. Obviously I would really like to deliver naturally, so just really hoping and asking the Lord for that to happen. May have already happened. I find it really difficult to tell what position she's in, but lately I think she has been in head down, so we will see. Maybe that will be confirmed at my next scan. So yes, we are hoping for the best, and we know that God has us in his hands, and that is very comforting and good to rely on just his plan for what's going to happen. So we will talk to you in the next update, and I'll see you then. Bye!